Okay, this section is entitled CAL OSHA Inspection, and this is where we talk about how these inspections are happening, what's the cause of these things, what's the most common cause, that kind of stuff, and what happens during the inspection. So let's go ahead and begin with what is the most common cause of an inspection by whether it's OSHA, the Department of Health, the boards, anyone for that matter. And you've probably guessed it, the number one cause of inspections are complaints by anyone. Who are these people? These are people who are not happy with you or maybe have an axe to grind with you or whatever. The key again is that we want to make sure we're doing everything in our power to not allow complaints to escalate. You're always going to make some mistake or somehow you're going to make someone unhappy, but it doesn't mean that it should lead to a complaint going to a state agency. So here's some tips on how to minimize complaint escalation. Let's take a look at these. The first thing you want to learn to do is how to be a good listener. Good body language, good eye contact, maybe your head going up and down in agreement or in attentiveness. These are great signs of a good listener. Make sure you let the person not be interrupted when they're talking to you, especially when they're bringing something important like a complaint to your attention. They've already got their nerves up to come up and give you this complaint or talk to you about this complaint. Most people don't do that. Most people just ignore it and you'll never see them again because they're not, they're shy and they don't want to give or tell you what the complaint is about. So make sure that you're always open to any complaints, and the first thing you should do once the person completely finishes what they are saying is to thank them for bringing this particular issue to your attention. Reward them for being someone who's bringing things to your attention. Be thankful. And certainly, this also brings up a point of giving compliments. Sincere compliments are one of the best ways to keep customers and patients happy within your facility. Not only customers and patients, but also employees. Fellow employees should compliment one another, recognize people for good behavior, good acts, good task completions, things like that. Very, very important that we offer rewards and offer compliments to each other. And the next thing that's very important is if something goes wrong, you make a mistake, it's not the end of the world. Please don't reside to making an excuse for that mistake, blame someone for it, justify, God forbid, or making sure that you don't defend yourself, okay? Just own it and handle it. I'm sorry, Mr. So-and-so, that this happened. How can we make this up to you? How can we remedy this situation? What can we do to make you happy? That's all the patient wants to hear, or for anyone for that matter. So that's important. Don't throw someone under the bus, okay? That is not good. The next thing is make sure that whenever you respond to a patient or anyone, again, for that matter, that you respond calmly. Don't ever let your emotions get the best of you and react emotionally. We've had situations where patients did very inappropriate things to employees and the employees reacted emotionally by getting angry, yelling, screaming, getting into an altercation, even a physical altercation where a patient was slapped at many times. And these always result to horrible things, such as the employee getting arrested and being charged with a misdemeanor offense. Don't ever take matters into your own hands. If someone did something inappropriately to you or said something inappropriate to you, just say, hold on 1 second, I'll be right back. Go get one of the doctors or someone in a position of authority to handle the situation in the best way possible, whether they're going to dismiss that person as a patient or maybe give them a stern warning and making sure that this never happens again. So these are the kinds of things that happen a lot in many, many offices. Next thing I want you to learn is how to empathize rather than sympathize with patients. For example, if a patient comes up to the front receptionist and says, hey, Mary in the back was really rude to me the other day, to sympathize with her, the receptionist would say, oh my God, what did Mary do? What did Mary say? Are you okay? And what that does is just fans the flame. So what do? Empathize. How you empathize, you simply respond, "Thank you so much for bringing this to my attention, Julian. What I'm going to do as soon as you leave, I'm going to have a talk with Mary. We'll get to the bottom of this, and please expect a call from me by this afternoon and let you know what I find out." Patient leaves, they're happy, they feel they were heard, everything's great. And then you come back and call them that afternoon and you say, "You know what, we talked to Mary. I just want to let you know this was completely unintentional. We value you as a patient, and we're going to make sure that next time you come, we pay special attention to how we treat you and how we deal with you as a patient of ours." And Mary has been warned as how she's talking to people and to pay more attention to the way she communicates with patients. And that pretty much closes the whole case, right? And you move on. And of course, last but not least, just promise to do the best you can to resolve the matter. Sometimes you can't resolve the matter. Something has already happened in the past. There's nothing you can do. My suggestion is get a few gift certificates to local, places around you, maybe a coffee shop or something. Give them a $5 gift certificate for a cup of coffee, maybe an ice cream, and that's it. That usually handles the situation. So these are the things that I suggest in complaint escalation. The next most common cause of an inspection is a work-related injury or illness. Again, you want to make sure that you are reducing your work injury, what we call workers' comp claims. You want to make sure that you do everything in your power to reduce workers' comp claims. Now, workers' comp is directly connected to OSHA, and anytime you have a workers' comp claim, OSHA is notified, so they keep a record of you. They call this experience modification rating. It's a special rating they give employers, and if your XMOD ratio is above 125%, you could be targeted for an inspection. That means you had too many incidents or they were serious incidents. Some of the things to keep in mind as red flags would be if 3 or more people within the facility get injured at the same time. If an employee is injured and it's serious enough where they have to be hospitalized overnight. If someone gets injured and they are unconscious and they can't return to work for a few days. Anytime there is any type of permanent damage to an employee or prolonged damage to the employee, or God forbid, anytime an employee dies within a facility, you can be rest assured that you will be visited. So what do we learn from this? Well, you need to learn from any incidents that have happened in the past or even other facilities incidents that have happened to them. Then you need to establish a new policy of how to avoid this incident from happening again. I'll give you an example. We had a case where a dentist was giving an injection to a man who was sitting in a dental chair. Doctor was fully protected, gloves, mask, gowns, shields, everything ready to go. And so she retracted using her thumb and index finger like that, giving an injection. Something flew into the patient's eyes. Patient moved. The needle came out and went right into her thumb. And she had just aspirated, so the needle was full of blood. And unfortunately, the patient was already a known HIV positive patient. So this is really the worst nightmare of a dentist, as you can imagine. And so this was a traumatic experience for this particular client of ours. And she had to go directly to the nearest hospital. She had to take these nasty medications that actually helps to kill the virus before it incubates. That's HIV virus, and these are HIV medications. Really bad side effects, but she took it. It took a year before she knew that she was cleared. Thank God she was cleared and didn't have the virus, didn't have HIV, wasn't infected. And then, of course, everything went back to normal. But for the whole year, she was devastated, right? How could we have made sure that this particular office would implement some kind of a policy so that this would never happen again? Well, we came up with 2 policies. One was every patient needs to what? Have an eyewear or eye protection during any kind of dental procedure. Now, if you're a plastic surgeon, you might want to do the same thing. If you're working in the mouth, maybe you want to cover the eyes. If you're an oral surgeon, you can do the same thing. So again, eyes are a source of what? Items flying into it, and then the reflex is completely uncontrollable, right? So they move and something goes wrong. So eyewear over the patient's eyes is an excellent, excellent policy to implement in this case. And the second thing we implemented in this office, and we teach this now to everybody, is don't use your fingers when you're retracting to give an injection. You can use the mouth mirror, which is an instrument, and it keeps your fingers away from the end of the needle, right, to retract. So these are important things that we learn from each incident. If we study the incident and come up with ways to prevent it, that's called injury and illness prevention, which is one of the standards of OSHA. Once you establish these policies, then you need to what? Train your staff on them. And you need to enter them and write them down into your safety policies manual, which we have an example for you, a sample template that you can download from our website, and you can personalize that to your office. There's some sample policies on there, and you can use those. And it's the format that's more important than anything, but there's some policies on there that you want to keep because they're mandatory, especially for dental offices. And the rest you can choose, they're optional. You can choose to keep them or not keep them. And then you can add additional policies as you find out more and more about different things. And you can continue to use this. Then after that, you train everyone annually, and then you review everything on a regular basis. You can also use quizzes to keep this information better retained, as well as drilling. Now, what's the difference between a quiz and a drill? Quiz is just a question that you ask, whether written or verbal. Drilling is actually asking the employee to come and show you. It's a physical action of showing you how they do this task. That's called drilling. That, again, further helps to retain the information. And then, of course, you want to document every training that you do. We just talked about having a safety policies manual. This is very, very important when it comes to reducing or preventing injuries and illnesses happening in the workplace. The final item that you want to fill in your handout is the least common cause of an OSHA inspection. That's a random inspection. And these are offices that have 11 or more employees usually. They're larger offices, or any offices that have previously had issues with OSHA sometimes are randomly inspected. So again, keep that in mind. Now we're going to discuss what it's like to be inspected. Well, the first thing you're going to see that an inspector just shows up at your office. They're going to have some kind of an ID issued by the state. If they're federal, they're going to have federal IDs with their picture on it, usually some kind of an official looking badge. And they're going to have a business card usually, right? So the front reception, when they greet this person, you should just ask them to show you their ID, get their business card, and then ask them to have a seat and let them know that you're contacting your representative so that they can talk to them. The inspector is now asked to sit in the waiting area. You don't want them to come into the office, or doctors should not invite them back to their office. And then what you do is you contact your consultant. Now, obviously, if you're a client of ours, you can contact us. And you have our numbers, and it'll also appear on your screen right here. So go ahead and give us a call, and then what we do is we ask to talk to the inspector. So at the end, then hand the phone over to the inspector. We do what's called an opening conference, and then we begin explaining what we've done for the office and in detail, and hopefully let them know that they're not going to find much here based on our detailed explanation of what we've done and how thorough it is. Usually they're not all of a sudden in a hurry to do an inspection. So they're very open now to do a reschedule, which is what we usually ask for. And they'll come back in a day or two, or maybe that afternoon at the worst case scenario. So that gives us a chance to kind of get regrouped, make sure that we can do a pre-inspection, whether we do it for you or you do your own pre-inspection. We guide you over the phone, or if you're close by, we can just come to your office if you're in the Northern California area. And certainly if we need to, we can fly out to wherever you are. Even if you are in a different state, as long as we can find some time, at least postpone the inspection for a week or so, and then we can arrange to have somebody come out and see you. Now, once we do a pre-inspection, then we come back again, or usually stay until the person comes back for the actual inspection, and then we accompany the inspector throughout the entire inspection. And Also, some of your employees will be interviewed by these inspectors, and so on and so forth. And we will do all the document requests. We do all the different appeal process afterwards at no additional cost to you. If you are a premier subscriber, if you're just a basic subscriber, then there might be some additional charges for that. So we can discuss that obviously with you. Now, what do they look for during the inspection? Well, the first thing they're going to look for is, do you have your written plans established? Well, these things are looked at. They look for personalized written plans, as well as the fact they're updated to the most recent OSHA information. The next thing they're going to look for is, what type of plans do you have? And they're going to want to have all of these different chapters available. Then we have, of course, the safety data sheets, or SDSs. They're going to look for an organized safety data sheet, personalized to your facility, and complete with janitorial and household sections. Again, our safety data sheet manual will pass inspections, we guarantee it. Employee posters are one of the other things they're going to be looking at. These are, again, postings that you put for labor posters. These are like minimum wage, sexual harassment, discrimination, OSHA posters, labor board posters, all these kind of things, and both state and federal posters. And we're going to make sure that these are completely filled out. All the blanks have to be filled out, and they must be, again, updated to the most recent information and regulation. Then they're going to look for different physical compliance things. If you're CAL OSHA or OSHA, they're going to look for certain things. If they're the dental board or medical board, they're going to look for certain things. If they're a fire department, they're going to look for certain things. So depending on the agency, they're going to look for different things, such as cross-contamination, storage issues, safety equipment inspection, electrical inspections, and those are all different types of things, and we want to be prepared for all of that. The last thing, and the most important thing also, is the record keeping. So the record keeper has a very important task, and you want to make sure that they're keeping good records of all the different things that you were doing, periodic inspections, periodic safety reviews, as well as annual fire drills and evacuation drills, and all of the documents for brand new hires of employees, and the list goes on. You want to make sure your records are up to date and current, okay? Now, the last thing is employee training. Employee training, they want to see evidence of the annual training. They want to have evidence of safety meetings, again, periodically, at least quarterly. If you're a larger facility, you want to do them maybe every 2 months or even every month. The emergency drills once a year, or if you want to do earthquake, is two times a year. Change of risk category training, which is basically a training when someone changes job description for a higher risk. So they started out as a receptionist, now they're a dental assistant or a medical assistant, and now they have a higher risk position. You have to show a training evidence for that particular change of risk category. Then, of course, we have a new hazard introduction training, and that's when you introduce a new hazard into the workplace, such as a laser equipment, for example, or a new x-ray equipment, or a new autoclave that you just purchased. These are new hazards introduced into the workplace, even chemicals that are considered hazardous material. If that ever happens, you have to hold the training and go over the safety aspects of that new hazard introduced into the workplace, and then have a document for that. The last thing, but not least, is the initial employee training, and you want to make sure that that's being done. And of course, at the end of the inspection, there's a closing conference, which we will be involved with if you like us to, and all the follow-up with document requests and appeal. And that's the end of this section. Thank you so much for your time.